10 warning signs and symptoms of breast cancer. It could save your life. Did you know that 1 in 8 women in the United States will suffer from breast cancer at some point in their lives in 2024 alone? The National Breast Cancer Foundation estimates that over 300,000 women and 2,800 men will be diagnosed with invasive breast cancer. So the pressing question is, how can you avoid becoming part of this statistic? Well, the answer is early detection. You see, when breast cancer is discovered early, it's much easier to treat and survival rates improve significantly. And that is exactly why Dr. Bennett has put together this important and potentially life-saving video in this video. Dr. Bennett will share the top 10 warning signs and symptoms of breast cancer that you should never ignore. These are signs that many people tend to overlook or dismiss as something minor, but recognizing them early could truly make the difference between life and death. But before we dive in, let's take a moment to define breast cancer and its risk factors so that you have a clear understanding of what we are dealing with. Breast cancer usually begins in the milk ducts, or the milk-producing glands of the breast. As it develops, the cancer cells can spread into the neighboring breast tissue, forming a noticeable lump if not treated. The cancer may advance further, spreading to the lymph nodes and other parts of the body, a process called metastasis. And this is what makes breast cancer so dangerous, because once it spreads to other organs, it becomes significantly harder to treat, and the chances of recovery decrease considerably. That is why understanding the disease from the very beginning is so important. Numerous factors can increase the risk of breast cancer. Age is one of the biggest. With the risk climbing sharply after age 50, family history also matters. Having a close relative with breast cancer raises your chances considerably, because certain genetic traits can be passed down from one generation to the next. Hormonal factors like starting your period early or going through menopause late can also increase the risk, because these situations mean that the body is exposed to estrogen for a longer period of time, and estrogen can fuel the growth of certain types of breast cancer cells. Lifestyle choices such as consuming alcohol, smoking, being overweight, and not staying physically active are other elements that can make breast cancer more likely. These are factors that we have some control over, and making healthier choices can help reduce the overall risk. Additionally, exposure to radiation and certain genetic mutations, such as those in the BRCA1 and BRCA2 genes, can substantially elevate the risk, and people who carry these mutations are often advised to undergo more frequent screenings and monitoring. Unlike women, breast cancer is uncommon in men, making up less than 1% of cases in the US, with a lifetime risk of 1 in 726. It's most frequently diagnosed between ages 60 and 70, with an average age of 67. However, breast cancer is more deadly in men because they are less likely to suspect a lump is cancer and are often unaware of the condition, leading to delayed diagnosis and treatment. That's why it's extremely important for both men and women to pay attention to the warning signs before it's too late. Awareness is the first and most powerful step toward protecting your health. Now let's jump right into 10 warning signs and symptoms of breast cancer that could save your life. Number 10, changes in breast size. Changes in breast size can be a subtle yet significant indicator of breast cancer, often overlooked until it becomes more pronounced. Imagine waking up one morning and noticing that one of your breasts seems slightly larger than usual. You might think it's just a temporary change, perhaps due to hormonal fluctuations or even how you slept. But what if this change persists or becomes more obvious over time? That is when you need to pay closer attention, because persistent and unexplained changes in breast size should never be ignored. Breast cancer can cause changes in breast size due to the growth of a tumor within the breast tissue. Unlike normal cells, which grow and divide in a regulated manner, cancer cells multiply uncontrollably. This unregulated growth can lead to the formation of a mass or lump within the breast, which can alter its size and shape. Sometimes the change may not be dramatic, and it might only be noticeable when you compare one breast to the other. While some degree of asymmetry is perfectly normal, a sudden or progressive change in size is worth investigating. If you notice any persistent changes in your breast size, it's essential to consult a healthcare professional for a thorough evaluation, because catching this sign early could lead to a much better outcome. Number 9, changes to the skin's texture. Breast cancer occurs when abnormal cells in the breast tissue grow uncontrollably. Forming a tumor, as the tumor grows, it can affect the surrounding tissue, changing the skin's texture in ways that are often quite noticeable if you know what to look for. This can result in dimpling, puckering, or an orange peel appearance, with small indentations on the breast. The skin may start to look and feel very different from its usual smooth surface, and this is a sign that should prompt immediate attention. This texture change happens because the growing tumor pulls on the surrounding tissue, creating an inward tugging effect. This tension pulls on the skin, causing it to dimple or pucker in specific areas. Additionally, cancerous cells can spread to the lymphatic vessels in the breast, causing a buildup of lymph fluid. This can lead to swelling and inflammation, further affecting the skin's texture and making the breast feel heavier or more uncomfortable than usual. Regular breast self-exams done carefully and with attention can help you notice any changes in your breast texture at an early stage, and Dr. Bennett highly encourages making this a regular habit as part of your overall health routine. Number 8, itching or irritation. Itching or irritation in the breast may seem like a minor issue, perhaps caused by a new fabric or temporary skin irritation. However, if the itching persists over several days or weeks, it could be a sign of something far more serious than just a skin reaction. Breast cancer can appear in unexpected ways, and itching or irritation can be one of its subtle yet crucial symptoms that people frequently dismiss without a second thought. This symptom can be a sign of inflammatory breast cancer, or IBC, a rare but aggressive form of the disease. Unlike other types of breast cancer, IBC doesn't usually present with a distinct lump. Instead, it causes noticeable changes to the skin and tissue of the breast, making it particularly difficult to detect through standard self-examination. Alone, this type of irritation can be due to cancer cells obstructing lymph vessels in the skin. When these vessels are blocked, lymph fluid can't drain properly, causing the skin to become red, swollen, and itchy. If you experience persistent itching or irritation in the breast area that doesn't seem to have an obvious external cause, do not hesitate to get it checked out by a medical professional. Number 7, a marble-like hardened area under your skin. A marble-like hardened area under the skin can be a silent but concerning sign of breast cancer, often going unnoticed until it becomes more apparent. Many people discover these areas accidentally while getting dressed or during a routine self-examination, and it's important to know what to do when you find one. This hardened area is usually an indication of a growing tumor within the breast tissue, which can cause changes in the breast texture and structure, leading to the development of hard, immovable lumps. These lumps are usually irregular in shape and can be felt as distinct masses under the skin. Unlike benign or harmless lumps, which are smooth and movable, cancerous lumps are typically firm and fixed in place. They don't slide around when you press on them, and they tend to feel deeply embedded in the tissue. While normal cells grow and divide in a controlled way, cancer cells multiply uncontrollably, causing a mass or lump to form within the breast, altering its size and shape. If you ever feel something that resembles a small hard marble or any unusual hardened area beneath your skin, please seek medical advice promptly because early diagnosis makes a tremendous difference. Number 6, breast or nipple pain. Unlike other discomforts that come and go, pain caused by breast cancer is steady and often localized to a specific area. This pain occurs as a tumor grows and presses on the surrounding tissues and nerves. The pressure results in persistent pain, which may also be accompanied by other symptoms like swelling or changes in the skin, making it easier to distinguish from regular hormonal breast tenderness. The intensity of the pain can vary from person to person and may become more noticeable in certain positions or during specific activities, such as exercising or even just reaching for something overhead. Some types of breast cancer, like inflammatory breast cancer or IBC, are more likely to cause pain. IBC is an aggressive form of cancer that makes the breast red, swollen, and warm, leading to considerable discomfort that can interfere with daily activities. The pain occurs because cancer cells obstruct lymphatic vessels, causing fluid buildup and inflammation in the breast tissue. If you are experiencing unexplained and persistent breast or nipple pain, please don't brush it off as something insignificant. Before Dr. Bennett moves on to the next important sign, we genuinely appreciate your support if you're finding this information helpful and want to stay updated on more health tips and awareness videos. Please give this video a thumbs up and hit that subscribe button. Don't forget to click the notification bell so you never miss an important update. Number 5, swelling in all or part of the breast. Swelling in all or part of the breast can raise many concerns, but it can also be a sign of breast cancer even if no lump is felt. And this is one of the reasons why breast cancer can sometimes be missed in its early stages. This happens because as breast cancer develops, it causes changes in the breast tissue leading to swelling that may not always be paired with a palpable lump. One reason for this is the growth of cancer cells within the breast tissue. As cancer cells multiply, they can cause inflammation in the surrounding tissue, leading to swelling that can affect all or part of the breast. This swelling can affect all or part of the breast, and a lump may or may not be present depending on the type and stage of the cancer. In some cases, the swelling may also be accompanied by redness, warmth, or alterations in the breast shape, which together can paint a clearer picture of what might be happening internally if one breast suddenly appears swollen or feels fuller than the other without any obvious explanation. It's a sign worth investigating with a healthcare professional. Number 4, nipple retraction. You might think nipple retraction is just a temporary change, maybe due to an injury or breastfeeding, but what if it's a sign of something more serious? Nipple retraction happens when the nipple turns inward rather than pointing outward as it normally would, and it can be a troubling symptom of breast cancer that deserves immediate medical attention. This is often linked to invasive ductal carcinoma, the most prevalent type of breast cancer, which can cause the tumor to pull on the duct behind the nipple, leading to retraction. The mechanisms behind nipple retraction in breast cancer are connected to the growth of the tumor and its impact on surrounding tissues. As cancer cells multiply and invade the breast tissue, they can lead to inflammation and scarring, which draws the nipple inward over time. This change may start off subtle and barely noticeable, but becomes more apparent as the tumor grows, and the tissue becomes increasingly affected if you notice nipple retraction. Especially if it's a new development, it's important to take it seriously and seek medical evaluation without delay, because this symptom, combined with other signs on this list, can be a strong indicator of breast cancer. Number 3, nipple or breast skin that is red, dry, flaking, or thickened. Imagine noticing that the skin on your breast or around your nipple has become unusually red, dry, and flaky. This could be a sign of breast cancer, often caused by cancer cells growing in the ducts or lobules of the breast and disrupting the normal skin function in that area. As these cells multiply, they can inflame the surrounding tissue, leading to visible skin changes that may be easy to spot during a regular self-examination. The skin may become red, dry, flaky, or even thickened and hardened, and in some cases may resemble the appearance of eczema or other common skin conditions, which can lead people to treat it as a skin issue rather than seeking a cancer screening. In some cases, skin changes may be accompanied by other symptoms like itching, burning, or tenderness. Another cause of skin changes in breast cancer is the blockage of lymphatic vessels. As cancer cells grow, they can obstruct these vessels, which are responsible for draining fluid from the breast. This blockage can lead to fluid accumulation, causing further skin changes that become increasingly noticeable over time. If these skin changes persist, despite topical treatments, it's crucial to consult a doctor. Number 2, nipple discharge, other than breast milk. Nipple discharge is any fluid that comes from the nipple except for breast milk during lactation, and while it can sometimes have a benign cause, it can also be a sign of breast cancer when abnormal cells in the breast tissue grow uncontrollably, forming a tumor that disrupts the breast ductal system. As the tumor develops, it can cause the release of fluid, blood, or pus from the nipple, serving as a visible warning of a potential cancer that should not be ignored under any circumstances. Nipple discharge can vary in characteristics, with colors ranging from clear to yellow, or even blood-tinged. It can also differ in consistency, appearing thin and watery or thick and sticky, and the presence of blood in the discharge is particularly concerning and warrants immediate medical attention. In some cases, nipple discharge may be accompanied by other concerning signs like a lump, skin changes, or nipple retraction, making the overall picture even more alarming. To detect nipple discharge as a possible sign of breast cancer, it's important to be familiar with your body's usual state and notice any changes that seem out of the ordinary, especially if the discharge occurs spontaneously without squeezing. Number 1, swollen lymph nodes under the arm or near the collarbone. Lymph nodes are small bean-shaped structures that act as guardians of the lymphatic system, filtering out harmful substances and supporting the immune system and keeping the body healthy and protected. However, when breast cancer cells spread from the primary tumor, they can invade nearby lymph nodes, causing swelling as the nodes work to combat the cancer and try to prevent it from spreading further. Swollen lymph nodes in the underarm or near the collarbone are especially concerning for those at risk of breast cancer, because these areas are close to the breast tissue's lymphatic drainage pathways. As cancer cells grow within the lymph nodes, they can obstruct the normal flow of lymph fluid, leading to swelling and discomfort that can sometimes be felt or even seen. Swollen lymph nodes may appear as small, tender lumps under the skin, often with a feeling of fullness or pressure in the surrounding area. While not all swollen lymph nodes indicate breast cancer, if this symptom is accompanied by other signs mentioned in this video, it's more likely to be connected to breast cancer and should be evaluated by a medical professional as quickly as possible. Remember, we all have a good chance of surviving breast cancer. The key is staying aware and paying close attention to your body. so you can easily detect any symptoms mentioned in this video. At the earliest possible stage, early detection can greatly improve outcomes and lead to more effective treatment options that carry fewer side effects and offer a higher chance of full recovery. Thanks for watching. Dr. Bennett hopes you found this information valuable and insightful. If you did, please don't forget to give this video a thumbs up, share it with others, and subscribe to our channel. Kindly hit the notification bell so you never miss an update on important health topics. Remember, the information provided in this video is for educational and informational purposes only. It is not intended to replace professional medical advice. Always consult with your physician or a qualified healthcare provider before making any significant changes to your diet, exercise routine, or healthcare plan. Your health is important, and having professional guidance can make all the difference in ensuring the best outcomes. See you in the next video.